Do I do it or are you doing it? Okay, thank you. Okay, Dr. Praderio.
Good morning. I happy to be with all of you at the beginning of this year. Happy New Year to you, Evelyn. Thank you for all of your help. And to everyone who got connected today. Looking forward to have a good time. What we are going to discuss today is what occurs every day as a question. In my 30-something years of practice, there is always someone, almost on a daily basis, asking me, Dr. Praderio, do you think this my mother, my father, my aunt have dementia or Alzheimer disease? Because we are not sure, they didn't explain to us. And you know, may occur this, the familiar doctor told you that your mother have dementia, when at the same time, other physician or professional refer as your mother have Alzheimer. Therefore, the confusion initiate and people struggle. Sometimes I hear conversation between them and my support group, trying to make a clear differentiation and talking about what is not the clear definition of what is going on. Therefore, I say, you are not alone with this. Let's go and talk a little more because I want you having a clearer concept. Dementia is an impairment of thinking. Have a common symptom, this is memory loss, to the point that the memory loss interfere, inabilitate the things that a person will do or was able to do during younger years. Therefore, dementia is a neurological disorder of the brain and have a big package of symptoms. We are talking dementia. We are defining dementia. And some of those symptoms of dementias are short-term memory. Please, today we need to leave our meeting saying that the memory that is compromised and dementia is the short-term memory. I remember when I graduated. I remember when we had the first child. I do not remember what I have for breakfast this morning. Therefore, the short memory is the one that we present difficulties in retrieving the material. And they have poor judgment based on an inability not to be able to learn material through life. We judge differently and we judge poorly. Doesn't make really sense the decision-making use. It's very childish. It's very simple. And we start having problems with familiar tasks. One of the common ones is we always receive comment at home. It's microwave oven. We have it for 20 years and suddenly we don't know how to operate it anymore. We don't know what happened because on the old memory, we have everything that we learn about the microwave. But the problem is this: at the present, we don't have orientation, we don't have planning, we don't have ability to perform some of the things that we already knew. We feel that something is not okay with us. We feel like someone is just getting on the way in our thinking, and that we don't feel the same way. And if we continue talking about dementia, we can talk about dementias that are reversible, and with this definition, meaning will disappear with treatment and you will be no longer demented. And there are dementia that are irreversible. You walk the pathway of the disease, and regardless what are the treatment, with no cure, you continue being demented. Let me share with you a reversible reason to have dementia is to have a low level of vitamin B12 in your blood. You have been suffering the loss of B12 for certain time, long enough to compromise the brain functions, to compromise your short-term memory, and to make you to present as a demented individual. Now, another reversible reason might be to have a hydrocephalus, mean liquid inside the ventricles of your brain that are creating pressure. And a neurosurgeon will put a tube, drain the fluid to the guts. The brain will return to normal shape, and you won't be suffering the dementia any longer. Two examples of reversible dementia. Irreversibility is when you have the dementia and you continue with the dementia. Well, with this little thing here and there, we are able now to reach and put together a definition of dementia. You never hear me until now to talk about Alzheimer. We are talking about dementia. And dementia is a conglomerate of multiple cognitive deficits that include memory impairment and at least one of the following: aphasia, apraxia, or anoxia, plus disturbance in executive function. Aphasia is difficulties in saying what we have projected and it's not coming out. And we call everyday word finding difficulties. The aphasias might be receptive because you talk to me and I cannot comprehend everything that you say. Or the affection may be expressive. This, I want to talk to you and I am missing one word here, one word there. Apraxia is difficulties with small neurological movement, winding your watch, using your pen. You get stuck not knowing why your pen is not working because we have difficulties in coordinating the movement to use the pen. And some executive function, specifically what we talked before, the ability to inhibit inappropriate behavior in how we judge and how we move. Now that we finish and we are satisfied and we can say, well, dementia is a neurological disorder that attack the brain, might be reversible or irreversible, and have the following symptoms. Let's open the chapter of how many dementias we know. Because this is the mother dementia, and these are the type of dementia. Therefore, you can put a dementia with the term Alzheimer disease. Therefore, this dementia is Alzheimer type. That's it. It's not this or the other. No, there is a dementia Alzheimer type, vascular type, Parkinson's dementia, Lewy body dementia, MS dementia, alcohol dementia, HIV dementia, etc. Many others. Clear in the mind of all of us today that we are not going to be struggled anymore if mom have dementia or Alzheimer. Mom have dementia, and if the doctors say might be Alzheimer, vascular, Parkinson, Lewy body, whatever is the type of the dementia. And because the conversation today is around Alzheimer's disease, I'm going to give you a little pearls about in this conversation about Alzheimer's disease. From the one that you saw in here, Alzheimer's disease have approximately between 62 to 68% of the cases in the United States. Therefore, if someone asks you what is the most important dementia in USA, it's Alzheimer's disease. And there's about 5.5 million of patients. These are statistics that we need to be careful. We don't know with certainty how diagnosis takes place. We don't know with certainty how people are isolated and never reach out for service. Therefore, we don't know how they are there. We know with certainty this is the third most costly disease in the United States. And it's ignored overall with this cause as a disease over others that are very well advertised. Dementia continue being very quiet, silent disease. These individuals don't talk majority of the time. The clinical course of an Alzheimer's disease have symptoms. These are clinical symptoms. I will share with you some of them because you will be able to see, wow, that's what my father or my sister had. The memory loss, remember this is short-term memory. Remember this, they are having difficulties performing tasks that they knew very well before. Remember my patient going to buy groceries, returning, stopping in front of the garage, beeping the horn, beeping the horn, beeping the horn, until a neighbor get out and say, Joe, what are you doing beeping the horn? And Joe say, I haven't been beeping the horn. I am just trying to open the garage. Confusing between the garage opener and the horn. Therefore, the performing of familiar tasks totally gone. There are difficulties naming objects. There are very common getting lost in familiar places. This occur. It's interesting for any one of you as a family members or caregiver to alert and to move ahead of this process. It's important to teach individuals to carry their phone with them and to call if they are in difficulties. Not to drive and drive. You say, well, if you get a little lost, just park and give me a call. Don't worry about this. Getting lost in familiar places may carry the complication that they continue driving and drive miles and miles away from home. Remember, with a lot of respect, empathy, and conversation around the family, there are times that maybe you can buy a little GPS tracer that they will have it with them. There might be a little bracelet, a pendant, something that is not visible, something that nobody needs to know except the one who cares for you. Therefore, you grab the phone and you say, well, look at this. It's around here, it's around there. Because many times when they get lost, they have difficulties in telling you where they are. Poor judgment, we talked before, and specifically, I suggest that you be careful with financial operations and decision-making process in which one may compromise the complete life. Be careful that there are people attempting every day on the phone and through message and email to abuse elderly, offering things that are not true, asking for money. They have a difficulty with abstract thinking. Therefore, they may keep the memory, another of my patients, they may keep the memory to know how to write the check to pay the bills. But then we may get stuck in simple event. I have a patient, we decide with the daughter that we want to support her and allow as much freedom as possible for her to feel good. We said that she will continue paying her bill because she loves it, and that the daughter will pick the envelopes and take it to the post office. And everything was nice until one day we have chaos because her television cable didn't work. And the daughter called and the cable never received the payment. And we initiate our investigation between a daughter who was just going up and down trying to find the solution to all of these problems, and me thinking about in what place we make a mistake. But the long story short, she wrote all of the check and put it in different envelopes. The cable check on the water payment, the electrical check on the other payment. And when we discovered there was such a mess, and I will tell you, probably the cable was the worst of all to fix it because she was so anxious not having her television. And therefore, this is a clear definition. This I have all memories. This I can apply very well, but my judgment and my abstract thinking, just I go rapidly and I make a mistake. They are changing mood, behavior, and there are some lack of initiative. They get a little more isolated. Let's talk a little about the stages of disease. This is a definition of a stage clinically applicable. Is what I talk to you every day. I said there is an initial or mild stage, an intermediate or moderate stage, in an advanced or severe state. And if you pay attention, maybe the moderate state is the longest one of the three. Sometimes they fluctuate rapidly. Not every type of dementia have the same amount of years. There are dementias such as Lewy body dementia. This is short on the progression, a total of between 7 to 8 years versus some Alzheimer dementia, who may go 12, 14 years in total. But this is an approximate stage definition. And I will share with you some of the symptoms of each one. At the beginning, there is a lot of repetition. But why repetition takes place? It's very simple. Pay attention to this. You ask me a question, and I answer it to you. And you hear me, but you never were able to encode my answer. You hear my answer, but never has been deposited on you. Never has been encoded in your brain. 2 minutes later, I ask the same question again. And you say, Mom, Dad, I just told you. relax because there is no, I just told you, they don't have no recollection of what you say 2 minutes ago. Therefore, we need to be cautious. We need to be soft. We need to have a good understanding of what is going on. I have 3 sisters. 2 of them living in Buenos Aires, Argentina. One of them living few yards away from the old house that we grew up in. Mom, widow, was living there, and the other live in town too. They see my mother on a daily basis. I am the one talking on the phone with mom, who will say to my sister that mom is asking me the same question in a 20-minute conversation. They believe this because I am in this business of psychiatry. I want to make mom demented or something because they claim that mom never asked the same question. A few months later, I went to visit in Argentina. And in a short conversation, all together happy, mom asked the same question 3 or 4 times. And I have to point it to them because in the daily time, be sure, sometimes we don't get it because we are accustomed to go to answer and not to pay attention. But that may occur. They lost things frequently. And the majority of the time is with a purpose. And you will say, with a purpose? I'm going to lose things with a purpose? Oh, yeah. You are so scared about the deficit of your memory. You have been feeling 3 or 4 times so ashamed of your lack of memory. There were 2 or 3 times in which the house had to hear that you cannot find your pen before going to work. And they were looking around and finally said, Dad, here is your pen, blah, blah, everybody happy. That you say, this doesn't happen to me anymore. I don't want to expose myself. When I get back home, I will know perfectly where to put my pen. I will leave it in the place I have it always with a key. But you know what? To be sure they will be there, I will just cover it. Because if I have it there tomorrow morning, I say, oh, I'll cover my pen. I mean, that's it. And tomorrow morning, nobody can find the pen, nor you or your family, because it's covered. And by accident, the one who finds the pen come and show it to you, and you drive to work thinking how she knew that was there. How she knew. She looked at me last night, and there is such a level of suspiciousness that can create the beginning in this stage of what is going to be on the following stage, mild paranoia. Anxiety and depression occur at the beginning. They isolate themselves a little more. You invite them, oh, let's mom come with us. We are going to celebrate the birthday of your granddaughter. And mom is coming, but she sits on the side of the party conversation. She doesn't want to interact much. She is afraid what they are going to ask if she will be able to answer. She is anxious to follow the train of the conversation. Too many people talking is very deleterious for your brain. Therefore, they have the feeling of sadness and anxiety. And we move to the center stage, the moderate stage. And honestly, you are going to notice when they are there because the behavior change. They are more confused. They are more difficult with dressing and simple activities. They get confused. False belief or belief that think are real. And this is what I told you when they found the pen or didn't find the pen, and they start with those feelings of suspicion. More supervision has to be put in place because they walk and they get lost, they escape home. They are hyperactive. They agitated themselves. There are a lot of irritability. The mood become a little more explosive. There might be lack of appetite, weight loss, and some type in a frontotemporal dementia type is on the contrary. They have hyperphagia, meaning eating most of the day. At the point they eat whatever is available, and they are more agitated. In this stage, remember the moderate stage, is the most common stage with individuals are being placed in supervised environment. From a moderate stage, you end up in an assisted living unit, in a nursing home, in a type of institution that will provide 24 hours of care, because it's the stage with more necessity. You preserve your hyperactivity physically, but you lose your sense of judgment and orientation, and it's a combination that makes you dangerous. You leave home, you escape, you get in trouble, you just go and cross a busy traffic in the street, you get hurt. Therefore, this is the stage the most individuals get placed in nursing home. And finally, we go to the severe stage. In general, the individuals are unable to do anything. The commanding through the voice disappear. They are unable to comprehend. They look at themselves on the mirror and they cannot recognize themselves. They have difficulties in communicate any one of the wishes. They cannot even say that they are on pain if for any reason they suffer pain. They don't recognize more family member, and they just end up with severe depressions and difficulties. What do we use for treatment? There is no cure. we all know and we repeat ourselves today. Until today, we don't have a cure. And we try to do the best in doing some treatment that we may define as a kind of maintenance treatment. But that's not a right term, because maintenance will be a treatment that provides you with the benefit of keeping you in a stable condition, when honestly doesn't happen. The treatments are pharmacological medicines, non-pharmacological case in part what we are doing today, learning more, behavioral intervention, understanding, having the concept of neuroscience to the service of who will serve. Because one thing is to drive your car, but another is to be a mechanic driving the car. What's the big difference? Well, the big difference is that all of your action when you drive will be mentally connected with what you know about engines. Therefore, this thing about educating caregivers and family members is the most that you know about the brain of your loved one, is the best that you are going to treat them. Because if they ask the same question 4 times and you get so out of shape and you start screaming, and I already told you, that won't make it better at all. But if I explain you why they ask the same question, you will feel really sad. You will empathize with them. And you will say, well, maybe I'll write it down in a little piece of paper, leave it by you, and next time we can talk about what I put in the paper. But anyway, pharmacologic, no pharmacologic. And then activities, this is important, very important. We have drugs that are called cholinergic inhibitor, Exelon, Aricept, Reminium. Namenda, this work at the level of glutamate receptor. And we combine some of them. And we work with the families. This geriatric care is very similar to pediatric care. You need to develop a triad between the doctor, the patient, and who is there to care. Identical than pediatric care, if the mom of the dead doesn't come to the visit, you are partially obtruded by the circumstance. And here, the same occurring with geriatric care. Still until today, certain degree of looking for corrections, because if I say early diagnosis is the most appropriate way to go, there are people always on the group telling me, Dr. P, early diagnosis, what will be such a big difference when you don't have a cure? And you need to say, you are totally right. But I wasn't saying early diagnosis is good because I can cure you. I was saying early diagnosis is good because allow you time to prepare for what is coming. Because you will have a longer time to educate yourself and others about what is expected. And honestly, you will do power of attorney and you never will have to go into a guardianship, because you can do a power of attorney very economical, and a guardianship is maybe $7,000 or $8,000. But the early diagnosis, education, and development of a treatment plan is very important. Remember that you don't split a human being by different diagnoses. If your father, mother, of the professional caregiver have a patient that initiate problem with cognitive dysfunction and have dementia, but the same individual have diabetes, COPD, and cardiac problem, please work all together, balancing and reaching equilibrium is very important. Do not believe that sending the patient to the geriatric psychiatry. This is going to put a patch of Exelon. It's going to control the sugar after you eat whatever is around with our diet. Therefore, we need to be consistent in a collaborative approach in working together. And our supervision of them should be exactly developed for them to have a life. This our supervision carry in one part all of the important component of preventing risk. And on the other hand, all of the beautiful benefit that everyone deserves to have a meaningful life. This is sometimes difficult. Sometimes the people run to one side or the other, and they punch their chest and say, I never will put my mother on the nursing home. I promised to her. And the mother is at home. With such a poor balance and no supervision, they end up with a bilateral fracture of the hip because she fell on the parking lot. Therefore, please be conscious about it. And share with others what you know. And if you don't know, you can always ask a question. You can participate in programs like today. You can participate in support groups. We have support group in a monthly basis, the 4th Wednesday of the month. We have something like today every month, in which one we chat a different session. And we have conversations that are very important. The evolution of life and the impact in our society are moving us in different directions. I love reading. All of my life, I love reading. And it's funny because now that I am aging, I am going around with an iPad or with my ebook, but I continue loving reading, but I want to read from a book. Therefore, sometimes our conversation have to be a little retracted, out of technique and evolution, and to sit together with a cup of coffee and to talk about what we know about this and what we would like to know. because honestly, there is an immense amount of material they won't even touch about earlier care in cognitive dysfunction. I think this we professionally, as well as the society at large, are looking at the tip of an iceberg. This is immense. And the most painful part is there is no curative intervention. Well, Evelyn, I think this we will just get ready for questions. I am expecting like this group is going to be on fire. And we are going to have questions and we have time to work with them.
Thank you so much. You're always the best, Dr. Praderio. Let me just say, kind of as the general lead-in to the questions, we are going to send out some resources to find your local support groups. We'll send the elder care locator and the information for alzheimers.org and the Alzheimer's chat room. So we'll give you some resources to find whatever you need in your local area. And with that, please open your phones, unmute yourself. We would love to hear from you. I see you do such a good job.
This is Myra, and I just want
Hi.
to say excellent presentation. So much good information that I can't wait for the recording to get loaded because I want to listen to it again.
Thank you, Mara. Thank you.
My mother has middle stage, I would say, middle stage Alzheimer's. She lives with me. I'm the full-time caregiver. I think before she got diagnosed with the Alzheimer's, she probably could have had some borderline disorder that was never diagnosed, because she was always very good person, but very difficult, very controlling, very explosive, just a very difficult person to get along. So when she got diagnosed with the Alzheimer's and I was able to take her to a neurologist, I said, I really can't, it's hard to manage and take care of her because she was having hallucinations, she was being aggressive. So they did recommend her to go see a psychiatrist as well. And they put her on olanzapine and another medicine that, if I'm pronouncing it correctly, it's Diva-Pro-X.
Yeah, yes.
So she's on those medications, just like the lowest dose. And I sometimes wonder, as she cognitively gets slower, should I maintain them on there? But we have to kind of remember what her baseline was like. And when I even suggested lowering the dose, she became aggressive again.
Yeah. Well, Mara, I think you impressed me by the very well described condition of your mother, including your mother taking medication, the name of the medication. Let me tell you, I was trying to divide the question in three parts. Number one, we carry any vestigios or any type of behavior and personality from our early years of life into adulthood and into early age. Therefore, the elderly that develop dementia may have, without any problem, some vestigios of who they were when they were young, explosive, no explosive. The ones that were chronic alcoholics, they were abusers, they were violent, they carried those traits into the dementia process. Segundo, they become disorganized on the moderate stage with some psychosis. Olanzapine is a medication that treats a little of the psychosis. And the valproic acid, you name it, is called Depakote, and calm down some of the impulsivity. Therefore, appear that this combination has been well placed And the last part of the question is, they progress, and sometimes progression is something that you need to take into consideration. If the patient is going to slow down, it become more appropriate, or sometimes you reduce the medication and chaos appear all over again. It's a process that has to be cautiously decided between you, the doctor, and you reporting what are the symptoms. I can help you with, if she become more quiet and sleep longer hours during the day, maybe it's time to start reducing a little the medication. But you need to discuss this with the doctor who is managing the case.
Thank you, doctor. Thank you very much.
Thank you, Marta.
Somebody asked if you could talk about the symptoms of Parkinson's.
Symptoms of Parkinson, another neurological disorder that occur in general at mid-age, characterized by rigidity, difficulties in performing movement, some rigid lower extremities with difficulties walking and mobilizing. The impact on Parkinson here in the brain, there are three components that we deal with. The first one creates depression. It's chronic and it's difficult to treat. It's a difficult to treat depression. The second one is psychosis, delusions, and hallucinations. And the third one is dementia. Therefore, an individual may approach the 65 to 70 having an underlying depression with mild psychosis and initial dementia as a product of Parkinson. The dementia of Parkinson is more violent than other dementias. The dementia of Parkinson have a better encoding of information than Alzheimer or vascular dementia. Therefore, they keep information longer than the other, and they encode a little better. I would suggest this nowadays will be not recommendable not to have your family member with Parkinson under the care of a neurologist. And after medication for Parkinson are arranged, adjusted, and graduated, you can resource, like we do very much in this town, they send them to the geropsychiatrist, and we manage the case together. I'll try to manage behaviors and problems that the patient have, and they continue monitoring medication as needed. Okay.
Great.
Any other questions?
Got a big expert here, folks. Let's see. Let's see. Some chats.
Doctor, you're based in Texas, right?
Yes, I am in Corpus Christi, Texas.
Now that we have Zoom in the world, do you ever consult patients that are out of state?
Well, excellent question. I may share presentations in service, different symposiums to any place outside of Texas and outside of USA. I do not make recommendation or suggestion that are clinical related, because we need a license for each one of the state that we practice. And I am a lucky person that's collecting very 3 or 4 licenses, but it's not all United States. It's Florida because I like Florida. It's Connecticut because it was my home and where I grew into my profession. And it's Pennsylvania because, don't tell me, because they wrote the Constitution and I don't know, but I have a license of Pennsylvania and horrible winters around Pittsburgh. Yeah, but part of your question is true. I can share some knowledge, but not make any medical recommendation.
Okay,
Thank you so much.
get a license in New Jersey, doctor.
In New Jersey, wow.
Okay, Dr. Praderio, I'm going to just do a little bit of housekeeping here. You have always, as always, done a brilliant presentation. It's so easy to understand. I know I really appreciate it, and I always learn from you. And I want people to know that we're going to be sending out a post-session questionnaire that we really would like you to fill out and tell us how we did in this presentation. And also give us any ideas you have for future presentations, either by Dr. Praderio or anyone else, any expert on a topic. We have recorded this, and you will find the recording at www.caregiverteleconnection.org. caregiverteleconnection.org, and you will probably see it by tomorrow or the next day. Minerva, and you can weigh in on that. However, you cannot just watch it yourself, but you can refer all your friends and other caregivers that you know to watch it, and also your physician, if you like, if they're willing to do that. So, we are in the process of planning future sessions, and I want you to know about a couple of them. And let's see, on Thursday this week, we have Dear Lucy, Life After Caregiving. On Friday, we have Healthy Life for Your Mind and Body, and suggestions from the latest research that will be in Spanish. So those of you who are Spanish speakers, please, you want to click on that one. And then Wednesday, the 18th, we had Accentuate Positive. On the 19th, we have Life After Caregiving Part 2. And then on the 19th, we also have Dementia and the Hidden Patient, which probably oftentimes is the caregiver. And then we have on the 26th, New Year's Resolutions for Caregiver Well-Being with Jamie Heisman. Everybody loves Jamie. And then on Tuesday, the 31st, Embracing Tender Memories in Caregiving with Barry Jacobs. Now, I just want to thank you all so much for being with us today, for your wonderful questions, for the attention that you've given our expert presenter, and to thank Dr. Praderio so much. He always does such a beautiful job. And if you have any questions that have been unanswered, please talk to our customer service representative. And oh, by the way, when you get that post-session questionnaire, you'll get a couple of resources, and you won't get them unless you're registered. So if somebody gave you the phone number or the Zoom link, please call customer service and get registered, and you'll get the monthly list of all the new presentations as well as the resources from presentations. And customer service is 866-390-6491, and ask to register for this so you can get the resources in the post-session questionnaire. I would also like to thank each of you for everything that you do every day for your loved one or for the one person that you're caring for. And I'd like to thank the WellMed Charitable Foundation for sponsoring the clinics, sponsoring the Caregiver Teleconnection, the Caregiver SOS program. They do so much in the community, the Stress Busters. They got a lot going on. And it's amazing how they've impacted the state of Texas and the state of Florida and I know that's probably why Dr. Praderio goes to Florida too. Go to those SOS centers. Yes. So, and thank you so much, Dr. Praderio. This was fabulous. And with that, I'm going to stop the recording.
Bye.
Thank you, everyone.